just look up a little bit. Nicely done. Okay.
Gosh. It's like a sense of relief.
Mhm.
Like, you know, I was like a little tight before.
In terms of your neck, I know, like your profession, obviously you're working over patients and you're looking down at them. But how long does it take for you to start feeling like a lot of the
Oh, it depends. Sometimes it's just 1 hour.
Okay.
Sometimes at the end of the day.
at the end of
So
the day?
yeah,
It just varies.
Varies
depending
a
on
lot,
that.
a lot.
Okay. And then is it only on the right side?
it's only mostly on the right side.
Okay. Do you ever get it on the left side?
No.
Pretty rarely.
Pretty rare.
Okay, but it's mostly right over here.
Yeah.
Okay.
Just because I think the way I sit, I just bend over like this.
So you are
towards my patient. Yes.
Okay.
Yeah.
And you're working on them always on the right side?
Yes.
Or on this
Always
side?
on the right side.
Okay, and then you tend to lean as you're
Mhm,
doing this.
like this.
Okay.
Uh-huh.
So yeah, and like we talked about last time, you can actually tell the swelling that you have on this side here. It's a little bit on this side here as well, but you can definitely see the trap muscles are really tight. But the trigger point that you said, it's more in this area, right?
Yes.
Okay. Which this muscle, so you have your scapulas here, and then you have this muscle that's called the levator scap that inserts into the scapula, and then it goes up into the base of the skull here. And so this is what we're looking at. So when you have that stress where your spine, you've lost the curvature and your head shifting forward, these muscles are trying to hold on to your spine. Okay. Now you'll notice here, because of you remember how we talked about how you have a huge lordosis in the lower back, and then it causes this to arch. So it makes sense now looking at the x-rays, like your spine, it's more rounded. It's not like you have like the strength of the muscles where you're kind of holding yourself upright. You have this arch here. So it makes more sense now that we're looking at the x-rays why this area, it's a little bit more of a rounded area here. So we're going to see if we can start to improve some of that, so then that way we can relieve some of the muscles and the tension here. So let's go ahead and scan you real quick. So for sure right at the base, yeah, it's around like your C7, C6 area. A little bit of pressure up on top. A little bit up on top here, see which one's gonna work on the lower. Yeah, right there too. Yeah, probably start on the foundation or the lower part of the neck here today. Yeah, really right there. Do you get much lower back discomfort?
Sometimes.
Sometimes? Now, when you say lower back, are we talking about lower down here, or more in this area as well?
Or like here.
Right into the lower part, yeah, so the base of your back. Yeah. That's right there. It's your L5, L4 area. All right, so we have some stress on the base of the neck. We have some stress in the mid-back. We have some stress here as well, and then we got some right in the solar. So let's go ahead and take a look here, how this is feeling. So this is going to be, I'm going to lean you back here. This is your L5. Sore there? And then you have your L4. It seems like L5.
Yes.
That's where you're feeling that. Okay. It's your T4. Sore there?
Yeah.
Yeah. So that's your T4. I'm going to go down to T5. Yeah, this is where the swelling is right there. So when I push in here, that's where you're feeling that. Is this where you feel the trigger point starts?
Right. It's a little bit towards
the shoulder blade area.
Like here. Yes.
Yeah.
But it's close.
Yeah. So we're gonna for sure start on T4. We might leave T11 alone today. Focus on L5, T4. Let me take a look at the neck here. 1, 2, 3, 4, 5. Here's C6, 7. 1, 7. Seems like that doesn't move very well. Yeah, We're gonna do C7 right there. So 7, 4, and then 5 here today. All right, so as you relax your right shoulder, I'm gonna a little bit of a push right there. This hand's gonna stabilize you here. And just look up a little bit. Nicely done. Okay.
Gosh.
Bring up the arm. That moved good, man. All right, so I want you walking on this. Go ahead and move back to the chairs. You're gonna walk towards me. Keep going back and forth. I want to get some movement in there. That moved really well. So what I'm going to do, I'm going to get your L5 right here. Yeah, you can even feel that's pretty warm right there too. So this is where that inflammation's kind of accumulating right there. So we're going to get your L5 right there. I'm going to roll you just a little bit. I won't drop you, okay? Now what I don't want to do, I don't want to crank on you and twist you like a pretzel. I roll your whole body as a unit so we're not twisting the spine too much, okay? What I'm going to do, I'm going to right here, I'm going to pin down onto the pelvis. With your shoulder, I'm going to push that shoulder up, not trying to crank you back this way, okay? Relax in there. So as you relax that shoulder, give it a little bit of a push right there. Good. Nice. Good job. All right. 1, 2, 3, 4. Yeah, you can even tell your
Right there.
skin is a little bit more sensitive because when I was pushing in on there, your skin, it's all white here, your skin complexity, but when I push on there, because of the inflammation and the swelling here, you can tell this is where your problem is right there. So we're going to work on that right there. 1, 2, 3, and then 4. All right, breathing in for me, deep breath, all the way out, dropping the shoulders. Oh, good job. Good, good, good. How does that feel? Because sometimes when I do some movement, it can get a little tense because it's like, oh, what just happened? Other times it feels a little different. What do you feel right now?
It feels good, but now it seems like the little bit lower is...
That one that we saw last? Okay, we'll rescope that and see what's going on. Yeah, everything's connected, so sometimes when we move something there, it will shift some things going on. So let's have a couple more walks. I'm going to rescope.
Feels pretty good.
Good. Okay, so yeah, so that's looking better. We still got some pressure on there, I can still see, but that's gonna be probably the biggest one that we need to work on, is this lower part of that T4 there. Let me see. Yeah, that's okay. So that's what we're gonna focus on for the most of your time here. It's gonna be this area right there. Yeah, that's cleared up pretty good on that one. Now, like I said, there's a lot of homework for you to do outside the office. You know, one of the biggest things, especially if you're working over patients like this, leaning forward like that, you really want to try to reverse that stress. So there's an exercise called Ruger's exercise. I don't know if you're familiar with it, but basically, because our posture, especially people on computers, we tend to be like this and like that, right? Our head's straight forward, our hands are on the front. So do me a favor, scoot towards the edge of the chair. The way we do this is we're going to try to reverse all that stress. So you're going to bring your feet out like this, feet out kind of at an angle like that. You're going to go ahead and bring your hands, you're going to relax them out to this side. Okay, and the reason why we're bringing it out like this is because we're trying to stretch out the shoulders here. And as you stretch out the shoulders and bring this, I want you to imagine your shoulder blades and you're squeezing them this way inwards, but then also squeezing them downwards. So it's actually going to help to bring the shoulders back, but then also down, okay? So you're gonna bring this out and then here, okay? Now the last part of this exercise and the stretch is that you're gonna tuck the chin in and then back, okay? And so we're looking more like this, okay? And that is a really good exercise, especially if you're sitting down a lot, trying to get some stuff done. You're just kind of bringing this here and then tucking the chin and then opening up your chest and just holding that for a few seconds. And then you relax there, okay? Now, that is something I want you to start focusing on, especially if you're there for, 15, 20, 30, 40 minutes, however much your procedures are. Just reversing that. Take some time to just, okay, let's just hold this here, tuck the chin in, and stretch out the chest, and just holding that for 15, 20, 30 seconds, and then relax in there, okay? But that's something you can do throughout the day. Like I said, because you're so into like this and leaning like that and working on some patients, we have to try to undo some of that stress. So you got a lot of work to do, okay? So just think of that, for all of your habits that we're forming, the ligaments get tight, the muscles get tight, we're gonna have to try to undo some of that, okay? So we got some work to do. All right, well, Good stuff, man. So we did your
Good.
C7, we did your T4, and then we did your L5. Things moved really well. Now we just got to see how it does and how it responds to that, okay?
That's great.
Any questions for me?
No. So, there is any other, like, stretching or something I can do?
Not right now. I want to see how you do with that.
Okay.
Other than the Brugger stretch, focus on that. When you come back in next time, what I'm probably going to want to do is get you some of the tractioning for that neck to see if we can reduce some of that. But right now, I just want to see how you respond to the adjustment, and the next time we'll talk about more stuff. Okay?
That's great.